What if I told you that 99% of the medical profession is wrong about what causes stomach ulcers? And what if I told you that one of the most common drugs to treat these ulcers has been linked to causing them in the first place? That's right, I'm not kidding. This is no exaggeration. In this video, we're going to uncover the truth. We're going to explore the research and find out exactly what causes stomach ulcers so you can avoid it. Now, stomach ulcers are open sores that develop on the lining of your stomach. And it's estimated that at least 600 million people worldwide have them. And they're caused by a bacterium called Helicobacter pylori, or H. pylori for short. And it was discovered in the early 1980s. Now, this microbe has a very interesting way of surviving. It lives in the highly acidic environment of your stomach, and it creates an enzyme that helps to neutralize the acid. This allows it to survive, but it also creates an imbalance in the pH of your stomach. This change in pH weakens the protective mucus and raises the potential for an ulcer to develop. It's estimated that about half of the world's population has this microbe, but only a small percentage of those infected will actually develop an ulcer. Why? Well, this is due to several factors, including stress, smoking, and drinking alcohol. But did you know that taking certain medications, particularly nonsteroidal anti-inflammatory drugs, or NSAIDs, is also a major risk factor? These are drugs like ibuprofen, aspirin, naproxen, Celebrex, just to name a few. In fact, it's estimated that about 30% of all ulcers are drug-induced. The problem with these drugs is that they inhibit the production of prostaglandins. Prostaglandins are hormone-like substances that help to maintain the health of the protective mucus in your stomach. Without them, the stomach becomes more vulnerable to the effects of acid, raising the likelihood of an ulcer developing, but there's more. A recent study found that people who were infected with H. pylori and took these drugs had a higher risk of developing ulcers than those who were not infected. So what does this mean? It means that if you have an H. pylori infection, you should avoid taking these drugs altogether. There are other drugs used to reduce the risk of ulcers, particularly drugs called proton pump inhibitors, or PPIs. These are drugs like Nexium, Prevacid, Prilosec, just to name a few. They work by blocking the production of acid in the stomach. But did you know that there is growing evidence that these drugs may be contributing to the development of ulcers? That's right. A recent study found that long-term use of PPIs is associated with an increased risk of developing ulcers. So, if you're taking these drugs, you may want to think twice. Now, given all this information, you might be wondering what you can do to protect yourself from developing an ulcer. Well, fortunately, there are some simple things that you can do. First, if you have an H. pylori infection, you should avoid taking NSAIDs altogether and limit your use of PPIs. If you absolutely must take them, however, make sure to take them with food and avoid taking them for more than 2 weeks without consulting your doctor. Second, try to manage your stress levels through exercise, yoga, meditation, whatever works for you. Just remember to keep those stress levels under control. Third, quit smoking and drinking alcohol. Both of these habits can weaken your stomach lining and make it more vulnerable to the effects of acid. By following these tips, you can help to keep your stomach healthy and reduce your risk of developing an ulcer. You know, it's ironic that the medical profession has been treating ulcers for decades, yet they've only recently begun to uncover the truth about what really causes them. Who knows? Maybe they'll eventually discover that ulcers are not caused by an imbalance in acid in the stomach, but instead are caused by a deficiency in certain nutrients. After all, we know that a lack of vitamin D, for example, can weaken the immune system and make you more susceptible to infections. It's possible that a similar mechanism could be at play here. This is the host, and until next time, I wish you great health, wealth, and happiness.